So, Joe John here again from Survivor Man. And I'm here with Dr. Pizzolatto. Can I call you Pizzy? Is that alright?
Sure.
Okay, Dr. Pizzy, who is a general physician and a surgeon in Yale New Haven Hospital. And thank you for coming and visiting us.
Thank you for having me.
Alright, so a few weeks ago we were filming an episode and on a hit show called Survivor Man. And I got a mild case of frostbite on my fingers. Now I know what frostbite is, but I was hoping that you could explain it a little bit more for the people that are watching.
Of course. Well, we usually diagnose frostbite based on physical signs and symptoms that we see. So we look for things like skin redness, numbness, or sometimes even blisters. We may also utilize diagnostic imaging tests such as x-rays, bone scans, and MRIs in order to make sure that no bone or underlying muscle is involved. Some differential diagnoses for frostbite include frostnip, trench foot, and hernia.
I see, that's very interesting. What are some common complications associated with frostbites?
Well, infections and hypothermia are the main complications associated with frostbite. But we also have to worry about infection, loss of sensation in the affected area, changes in cartilage between joints, which is also known as frostbite arthritis, and in severe cases, gangrene can develop, which is when the tissue dies and starts decaying, which is never a good thing. Mild cases of frostbite usually resolve within a few weeks, but more severe cases may take longer periods of time to heal and may require amputation if it's a very severe case. Doctors may prescribe pain medication if the patient is experiencing a lot of discomfort.
Wow, that seems pretty serious. Are there any psychosocial implications for frostbites?
Well, I'm glad you asked that, Joel, because there actually are. Individuals who have experienced a severe case of frostbite and have had to have digits or toes amputated may feel depressed, feel some social anxiety, and may be unable to participate in their previous meaningful activities and occupations, which can really be a bummer.
Next time I'm going to be a lot more careful by wearing my gloves and my muffs. Well, now I'm going to tell you another story. I was hiking with my mamacita one time, and something weird happened when she put her freezing cold hands near the campfire. I think the EMT called it chilblains. Can you tell me something about that and about how to diagnose chilblains in a medical standpoint? Because I just called her and I had a difficult time walking her through that.
Of course. So chilblains are a result of the body's abnormal reaction to a quick change in skin temperature. It's also known as pernio. Chilblains are diagnosed based on physical signs and symptoms. Physical signs and symptoms typically include a small itchy red area on the skin, usually around the arms, feet, or hands, skin swelling, and a burning feeling, and sometimes abnormal skin tone.
Wow, that's interesting. Now tell me, is there any other conditions similar to chilblains?
Yes, differential diagnosis, or in other words, a similar condition to chilblains, include Raynaud's phenomenon and acrocyanosis, which is a discoloration of the extremities as a result of oxygen deprivation. The outcome for chilblains is usually positive as long as it's treated properly and in a timely manner. There are not many psychosocial implications associated with chilblains, but individuals may find it more challenging to participate in outdoor activities in extreme weather and should adhere to doctors' precautions. Doctors may also prescribe corticosteroid creams for individuals with chilblains in order to help relieve itching and swelling. They may also prescribe blood pressure medication in order to dilate blood vessels to prevent this condition from occurring in the future. Infection prevention is another important aspect for chilblain care because infections can lead to much more harmful conditions.
Wow. Well, that was a very informative interview. Thank you, Dr. Pizzy.
Thank you for having me.
And I thank you for being part of Survivor Man. And a special thank you for my viewers watching me, and we're gonna have the next show 9 p.m. next week on Discovery Channel. Watch it.